what are the risks of delaying care? And I mean, everyone can answer this question if, like me, you broke your wrist and if I had delayed care, I probably wouldn't be able to use my wrist. So I went into the urgent care center. But for some things, it's not as straightforward as that, especially for chronic conditions like hypertension or diabetes. Now, for decades, you have been told not to delay or miss any types of care because of because there is a risk of negative consequences. But because of COVID-19, they were saying don't go. At first I was told don't go. You go only for essential services. And anything that was elective was to be postponed. So these decisions have made people rethink how they access healthcare over the last few months. But for over a year, we've been told not to go unless you really needed in-person care. But now we're at the point where we can go. And in the meantime, when they told us we couldn't go, there was telehealth, which some people used and some people didn't. Um, and that's there are issues associated with that. It's great, but there's unequal access. And there's some things that just can't be done via telehealth. Heart disease, cancer screening, diabetes. You know, really tough to do a mammogram or a colonoscopy via telehealth. Those need in-person care. So, along with exacerbating existing health problems, the pandemic has caused a whole host of new medical concerns in patients. The American population is coming out of the pandemic with, dental issues, back problems from slouching over a computer, mental health problems because you're in isolation. And while you love your family, you may have had too much of your family. Um, and no one really knows what the long-term effect of delaying all this care is. Doctors are now reporting seeing patients who are more severely ill than if they had come in earlier because people missed things like mammograms. So when breast cancer is now diagnosed, it is at a much higher stage and carries a greater risk of complications and death. So, patients may have stopped medications for example, treating glaucoma, which has could have a longer term impact on the loss of sight. So these are all really important things that you need to weigh, and I would strongly recommend if you need to go to the doctor, go get involved with all of those screenings that you haven't had in the past year, and don't forget to see your dentist.